In recent months, the killer disease AIDS has started to take a deadly toll among haemophiliacs in Britain. Over half have been infected with the AIDS virus after being treated with a National Health Service supplied clotting agent, factor VIII, designed to cure their blood disorder. 5 haemophiliacs have died so far, as AIDS has become the greatest public health danger since World War II. The latest inquest was held earlier this month in Newcastle upon Tyne. Afterwards, at a press conference, Dr. Peter Jones outlined the growing problem doctors who prescribed factor VIII now face.
We've had 3 cases of AIDS in this city. One was Mr. McStay, who died in Scotland. Mr. Jefferson was the first patient with haemophilia who's died of AIDS in this city. A further haemophiliac has died of AIDS since then. I have 1 further patient with full-blown AIDS, and 20% of my patients show some form of physical abnormality which could be attributed to AIDS.
A wonder product, the clotting agent factor VIII concentrate, revolutionized life for haemophiliacs. They could treat themselves at home and lead a more normal life. But demand quickly outstripped what could be produced in Britain, so over 50% had to be imported, mostly from the United States. There, the product is made not from volunteer donors, as in Britain, but from those who sell the plasma from which factor VIII is made. These include homosexuals and drug addicts, now identified as the 2 groups most at risk from AIDS, a new disease which destroys the body's immune system, making infection potentially fatal. Last Friday, the Department of Health estimated that 2,500 haemophiliacs have been infected by the AIDS virus as a result of using imported factor VIII. 3 deaths since May herald the start of what doctors fear will be a rising number who will die over the next 3 years.
We do know from the figures, both in the United States and the United Kingdom, that AIDS is growing with a magnitude unequaled by any other disease, with the exception of the poliomyelitis epidemic in the 1940s in this country.
Tonight, World in Action examines how Britain came to rely on a product that was always known to have health risks and which now threatens the lives of an increasing number of those who were forced to rely on it. Haemophilia is a rare complaint affecting men. There are 4,500 sufferers in Britain. All lack the vital clotting ingredient in their blood, which prevents internal bleeding and crippling damage to their joints. John Prothero, aged 41, is a civil servant from London.
You never know, literally from 1 minute to the next, if you're going to start a bleed in a knee, an elbow, anywhere in your body. Must have been 30 or 40% of schooling I just missed, right through primary school and right up to A-levels at grammar school. With no treatment around, every time you got a bleed, you'd be off work for a couple of weeks or so.
Godfrey is a 41-year-old clock repairer from North Yorkshire.
First of all, you lose a very slight amount of movement and you get a little twinge of pain in that particular joint. Those are the early stages of a bleed. As the hours go by, the joint movement is increasingly reduced. It begins to start to get hot, extremely painful, and if it's a knee bleed, in a few hours, of course, you just cannot walk. And you're in agony from the pain of it.
What actually happened with your hand?
That was due to a bleed in the forearm when I was about 12-year-old. And there was no form of treatment then, effective form of treatment. And so it just had to bleed in until the pressure stopped itself. And of course it took months to subside. All the old, the blood to subside away. And I was left with that.
John Strutt is a 35-year-old local government officer from London. He's married with 2 children.
Gardening is a particular problem that you have to give serious consideration to before you undertake digging or any form of physical exertion. In my experience, prolonged digging would necessitate at least 1, maybe 2 fairly difficult bleeds.
Any social life was non-existent, and job-wise would have been very difficult. You couldn't say that you would be at work, say tomorrow or next week, because you probably wouldn't. You may have a bleed.
I suppose the pre-treatment area could best be described as a bit of a nightmare in many respects. The constant episodes of bleeding, the severe pain lasting for anything from 4 to 6 weeks, and the prolonged periods of inactivity.
I suppose if I reached to be 20, 30, I would be very lucky. Indeed, yes. With all the hazards that there were, you would be very lucky to reach that area.